My name is Dr. John Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri. Welcome to our channel, J&J House Call. This is my wife.
Hi, I'm Dr. Jennifer Sue. I practice conventional gynecology and integrative medicine. Welcome back to our channel. If you've never joined us before, please go ahead and subscribe. We absolutely love integrative medicine and how we can help your bodies heal itself. And always hit that notification bell up there so you know when our next video is up. Hit the like button. We appreciate it. Today's topic's really good, but I want to first start with, maybe every week we can start with us saying what we're grateful for. And while you're there on your computer or tablet or mobile phone, you can just kind of think of one thing you're grateful for. I'll start and then you go.
Okay.
I'm grateful for maybe just the ability to not be in pain today.
Yep.
What are you grateful for?
I'm grateful for all the cool friends we have, and we had a great evening last night. We went to the American Heart Association Heart Ball.
Gosh, I've never seen so many people give so much out of their hearts just to help cardiovascular research. It's pretty cool.
Yep.
Today's topic is really good. Most of us know someone who has high cholesterol, and then you know the next thing they say is, my doctor wants me to take a statin. Is a statin a good fit for you? And that's our topic today.
Yep.
Always leave your comments below on any questions you have, and please put in the comments what you'd like to hear about in the future videos that we have, because we get our content from you.
Well, everybody wants to lower their cholesterol, especially if they have a documented history of heart disease, or they've had a heart attack, or they've got a family history. And it's just actually a good idea just to keep it under good control. And statins have always been kind of like the thing that the go-to medication that everybody uses. And some people think it should be given to almost everybody. However, that's not the case. Now they're starting to find out there are some significant side effects and complications that can come about when you're using statins. Now, I just want to say off the bat, I use them. Okay, so I don't want anybody to think that I'm trying to say that you shouldn't be on them, but you really should pause whenever you're being considered to be started on statins. Number one of the first things, especially in men, is that it can lower testosterone levels, and that can result in erectile dysfunction, increased risk of depression, and decreased lean body mass. It can also deplete the body of certain vitamins, as well as selenium, zinc, and copper, and also decrease the body of omega-3 fatty acids. So those are important things to consider. Now, the other things that it can actually cause mild cognitive impairment and increase the risk of Alzheimer's in some studies. Now, I've seen some that are disputing this, but again, that's a consideration. It can result in neuropathies, and 1 in 50 people develop diabetes type 2 after they've started statins. And 1 in 10 people really get a really bad muscle aches and some muscle damage from taking statins. So it's not a completely innocent medication. So it really should be, you should consider your risk and benefit whenever you're taking it. Now, if lowering cholesterol was like the answer to decreasing heart problems, then you would ask, why is it that 50% of people that have a heart attack, like myself, had normal cholesterol levels? And so other things play into this as well. And so what is very helpful to your doctor and to even a potential patient or an existing patient, there's an organization called American Heart Association, everybody's heard of, and the American College of Cardiology, that come out with guidelines regarding how to determine whether people are at risk for heart events and when statin is good for them. Now, they came out, the last one was in 2018. There was another one that came out earlier than that, just 5 years before. So the information keeps changing as time goes on, and this is just a reflection of research that keeps coming up and ways that people refine our current guidelines. And this happens in medicine all the time. One of the good things about the 2018 recommendations is that they encourage lifestyle therapies for everybody. So they want to make sure that you're just not taking statins, but you also have to exercise, eat the right foods, practice stress reduction. All those things are extremely important. Also, too, they expanded their list of what they call risk-enhancing factors, and I'll go over those a little bit later. One of the things that they did too was that the main emphasis was still on statin medication, but based on a risk of atherosclerotic cardiovascular disease. So it's not just given to everybody. And then they brought back some of what they call the LDL measurements and goals that you should look at. In 2013, they took these away. So now they're starting to look at LDL levels again. Remember, that's part of the the lipid panel that you usually get by your doctor. And also too, they started to discuss what is called PCSK9 inhibitors, which is actually a new type of medication. It's a non-statin. So this is new for the 2018 recommendations. And again, you always use these things together with therapies such as your diet and your exercise and so on. One of the things that you can use to develop or actually get a better idea if you're at risk, there's a website called Statin Decision Aid. .mayo.org. I went on this website today, and you can plug in a bunch of data depending on what your history, whether you've never had a heart attack, whether you've had or you've had one, how to determine what your risk will be with and without taking statin medication. So it's very important that you understand if you're a candidate. So what are some of the risk enhancing factors? What puts you at increased risk outside of the normal things like genetics and so on? And they do include these in the 2018 guidelines. Number one, if you're male, if you have a family history of premature cardiovascular disease, especially if you have a male family member that had an event less than 55 years old and a female less than 65 years old. If you're South Asian descent, those are individuals who are Indian or Pakistani, those are increased risk. Patients that have elevated levels of triglycerides, lipoprotein A, lipoprotein B, high sensitivity CRP. These are all lab values that your physician, and if they've read these guidelines, they'll be drawing on you. So it's not just going to be like the simple cholesterol, triglycerides, the HDL, the LDL. These are things that are now being recommended that we follow. The other things that they figured out too, that there's some individuals that have pre-existing autoimmune disorders such as lupus, rheumatoid arthritis. These tend to start increasing your risk of having an event. And they've discovered even with women who have preeclampsia, women that have menopause before the age of 40 years old, it seemed to be at risk. Those individuals also with chronic kidney disease, and people that have, or women that have had, or even men that have had left breast surgery where they've radiated that level of the chest. Remember, the heart is right below that area, and that can actually affect the vessels of the heart as well. So those are the things that put you at increased enhanced risk. So what's great about these guidelines, it does identify people that are at risk, it stratifies them, and actually can determine whether this person should be on statins or not, depending on the risk-benefit ratio. It also looks, as I mentioned, the risk-enhancing factors, which is extremely important. One of the other things that's also very important with the 2018, it really emphasized lifestyle management and the patient participation. If I've had patients come in that really kind of follow the diet, but not really to the detail that they should, and they think that the statin medication by themselves are going to solve the problem. They continue the bad habits such as excessive alcohol, eat a lot of red meat, they smoke, they don't exercise. Believe me, if you just depend on the statins are going to save your life or decrease your risk, you're wrong, because you're actually counterbalancing the benefits of the statins themselves. So let's say you've decided to either reduce your amount of statins that you're taking, which would, again, you discuss this with your physician. What other things can you do? Well, there are some things that are really simple to follow that will either reduce your risk of progression of your current heart disease or actually decrease the cardiac events. And some of the simple things, my first one I love the most is that daily intake of dark chocolate. That has been shown to decrease the atherosclerotic cardiovascular disease by at least 77%. Eating just a handful of nuts every day will do that. Eating what is called a Mediterranean diet, and we included some discussion about this in one of our previous videos, where there's a specific study that mentioned the Mediterranean diet. It's called the Lyon study, Lyon, which actually shows the benefit of the Lyon study. The other one is, again, exercising more than 30 minutes a day, moderating your intake of alcohol, no smoking, of course. There's really no good benefit for tobacco in anything. One of our other favorites too is owning a cat. For some reason, it also decreases your risk. The other one is use of extra virgin olive oil, especially if you do a lot of cooking. Remember, when you cook with this, use it at a very lower to medium temperatures because it does have a low smoke point, and actually that's actually can create bad things for you, not good things.
The dark chocolate has to be at least 70% cacao for the benefits, plus the antioxidant benefit.
Yeah. And there's some nutrients as well. We've mentioned these in some of our previous videos. Something called red yeast rice. Almost everybody seems to know this. Even the last 2 years, every time I mention this to one of my patients who are taking statins, I've already been clued in on this. If you don't completely replace your statins, you can at least lower some of the dose by taking this medication. Turmeric is one. Green tea, pomegranate are some others, and something called berberine.
And if you're taking red yeast rice, you do need to have your doctor check your liver function tests periodically, just like you would a statin.
Yeah. Well, that's it for today. Thank you for joining us. I hope this was helpful. And as each new update comes up, we're going to include this in our videos because, I've got a very personal interest in this, and I want all of you to get the benefit.
And remember to look at our mushroom video because those special mushrooms that we mentioned do help to lower cholesterol as well.
Yep.
Our midweek check-in is going to be how to either prevent an upper respiratory infection or cold, and also how, if you're starting to get like a scratchy throat, how to prevent it from getting worse. Our job is to help your body heal itself so you don't have to go to the doctor as often. So make sure you subscribe.
That's all for now. Thank you everybody for joining us. Have a great evening. Bye-bye.